Do you find that patients are usually good at following the care regimen that you recommend, or do you meet certain resistance with patients?
Yeah, I don't get it's a good question. I mean, do they follow? They follow up. They do the lab tests they need. If patients have cirrhosis, they're supposed to be getting ultrasounds every 6 months for liver cancer screening because there's an increased risk of liver cancer. Don't forget that if you're a provider. And the patients follow that. They have great difficulty, my experience, is in terms of weight loss. And some of that's our fault, my fault, because we really need to engage patients in proper uh, disciplines, looking at this as a multidisciplinary disease to actually help them. We say to patients, lose weight. Again, I mentioned this before. This is not the first time the patients have thought of this. They've tried already. So it would be helpful for me and other providers probably to try to engage them with other providers that can help them with weight loss and be more aggressive with that. And some patients have trouble with the alcohol abstinence recommendation. Many abstain from alcohol use when they find out they have chronic liver disease, even if it's not from alcohol, because alcohol in the setting of liver disease from something else isn't good either. But some patients have trouble with this and they continue to consume alcohol. So, we do the best they can. I find most patients engage. How successful they are, can vary.
The last question, the abstinence from alcohol, just this is completely, they can't have any alcohol whatsoever.
I mean, truthfully, they can have an occasional drink. But I can tell you the more they drink already, the less they should have, that they should abstain. If somebody says, "Doc, I have a glass of wine once a month," if they don't have cirrhosis, that isn't an issue. Now, if somebody drinks on a more regular basis or more substantial basis, those patients should abstain from alcohol use because they don't have one drink a month. They have more than that. And you have to kind of be more aggressive with that. There's a component of MASLD, metabolic associated steatotic liver disease, which they call MET ALD. That's metabolic syndrome, which is the fatty liver part, and it's alcohol related liver disease in one patient. So if you think a patient has risk factors for fatty liver and drinks a substantial amount of alcohol, that's more of a combined picture. And there happened to be a lot of research ongoing for them because those patients are a little different than the people that have pure MASLD and MASH.
Does their ability to completely abstain impact their eligibility for treatment at all?
Yeah, in the study that was done with resmetirom, which is the one approved drug for treatment of MASH and patients who have stage 2 or 3 fibrosis specifically, patients could be in that trial that drank up to 2 drinks a day, actually, which is a lot. So the data show that that drug has benefit, for instance, in patients with fatty liver who have up to 2 drinks a day. So technically, if patients have up to 2 drinks a day, and if they're otherwise a candidate for resmetirom, for instance, we would use it. If they're drinking more than that, then I think the balance starts to tip to alcohol related liver disease, and you might not want to treat them the same way.
Well, thank you, Dr. Flamm. This has been an excellent conversation. I can't wait to talk to you again when something new, hopefully, emerges in the world of MASH and treatment. But it's been a pleasure having you as always.
Thank you so much. Thanks for the interview.